In this video, we are going to talk about some medications used in eye and ear disorders, in diabetes mellitus, and some endocrine disorders. So let's start with drugs for eye disorders. The first one is the beta-adrenergic blockers. Examples to these are timolol, betasolol, levobunolol. So mechanism of action, basically, these drugs block beta-adrenergic receptors in the ciliary body of the eye, and as a result, it will inhibit sympathetic stimulation, and thereby it will decrease aqueous humor production and leading to a drop of the intraocular pressure. In that process, this prevents optic nerve damage and resolves issue in glaucoma. So these are indicated for those suffering with open-angle glaucoma and ocular hypertension. So the way to give this medication, it is given topical eye drops, instill it into the conjunctival sac, and then after which apply punctual occlusion or gentle pressure at the tear duct for 1 to 2 minutes. This will reduce systemic absorption. Some nursing consideration for this beta-adrenergic blocker: always monitor for systemic effect, as this drug can lead to bradycardia, hypotension, and bronchospasm. And check pulse and blood pressure before use, especially those patients with cardiac disease. Instruct patient not to touch the dropper tip to the eye, as this can lead to contamination. Again, teach the client to do the punctual occlusion technique, which is the application of gentle pressure at the tear duct for at least 1 to 2 minutes. And again, caution in the use of this medication for patients with asthma, COPD, or heart block. Another drug is the prostaglandin analogs. Example to these drugs are your latanoprost, travoprost, bimatoprost. So how does these drugs work? These drugs mimic prostaglandin, and so it increases the uveoscleral outflow of aqueous humor, or the fluid inside the eye. With that outflow, this will reduce intraocular pressure more effectively than many other medications. That's why this is the first-line therapy for open-angle glaucoma and ocular hypertension, because it reduces fast the fluid by increasing outflow of the fluid inside the eye. So the way to give it is topical eye drops once daily in the evening. Now, a very important consideration: this can turn eyes brown permanently, so monitor for iris pigmentation, and it can also lead to eyelash growth and eyelid darkening. So instruct patient to remove contact lenses before installation, and make sure unopened bottles are kept in the refrigerator. And when using, report any ocular irritation or visual changes. Then we have the carbonic anhydrase inhibitors. Common drugs are your dorzolamide, brinzolamide, acetazolamide, and they come in different formulations. So how does these drugs work? Again, they inhibit the enzyme carbonic anhydrase in the ciliary body epithelium, causing now a decrease in the bicarb ion formation, thereby again reducing aqueous humor secretion. So the drop in the aqueous humor, or fluid inside the eye, will lower the intraocular pressure. So that's why this is given for those with glaucoma, ocular hypertension. Now, systemic acetazolamide is used in acute angle closure glaucoma. So how to give: topical drops 2 to 3 times daily, And the oral and the IV acetazolamide is used for short-term emergency management. Now, as part of nursing consideration, this drug can lead to hypokalemia and hyponatremia as it loses fluid. And this is a sulfa drug, so contraindicated to those with sulfa allergy. Increase fluids to prevent kidney stone formations. And common systemic effect is paresthesia, GI upset, fatigue, so monitor for those, and always monitor also the kidney and the liver to check that they are functioning well and with the use of this systemic therapy. Let's go to drugs for diabetic patients. So the most commonly used drug are the insulins, and we have four types. We have the rapid acting, the short acting, intermediate, and long acting. So examples of these rapid acting drugs are your Lispro, Aspart, Glulileucine. For short acting, of course, we have the regular insulin. The intermediate acting, we have the NPH, and the long acting, we have the Glargine and Detamir. So basically, insulin is what we need, what our body need. It binds to insulin receptors on cell membrane, causing now or triggering glucose transport into the cell. Basically, it allows glucose to be consumed by the cell. That's the main function of the insulin. And it also promotes a storage of this glucose in the form of glycogen, also storage of fat in the adipose tissue, and protein synthesis. So this is used for people with type 1 diabetes, also those with type 2 diabetes that is not controlled with your oral agents. It can also be used to reverse hyperkalemia and manage diabetic ketoacidosis. So how to give your insulin? Generally, it's given subcutaneous injection to fatty areas in the body such as abdomen, thigh, arm, and buttocks. It can also be given IV, but this is basically for management of diabetic ketoacidosis and your hyperkalemia. And make sure you rotate injection sites when giving. This is to prevent lipodystrophy. So some important nursing considerations. So before giving insulin, check blood glucose level. Only give when it is high. Don't give when it's low. Okay? Educate about hypoglycemia. That's when sugar is low and you're not supposed to give insulin because that means sugar is low. And the signs would be shakiness, sweating, confusion. Now also remember, do not mix your long-acting insulin such as your Glargine and Detamir with others in the same syringe. Always teach your patient proper injection technique and site rotation. And those that are unopened insulin, keep them in the refrigerator. Know that open vials are only stable at room temperature in approximately 28 days. So you need to label your vials after opening to know that it is already within or past the 28 days. The other diabetic meds are your biguanides. An example to this is your metformin. So metformin decreases your liver or hepatic glucose production, and it also decreases intestinal absorption of glucose and increase insulin sensitivity, thereby enhancing glucose uptake. So in other words, it is not an insulin, but rather a medication that increases sensitivity of insulin, thereby increasing glucose intake and utilization. So this drug is used for type 2 diabetes wherein the patients are able still to produce insulin. We just have to enhance those mechanism. So the administration is oral, taken with meals to reduce GI upset. So some nursing consideration, there is a high risk for lactic acidosis when there is kidney impairment. So always monitor renal function. And then hold 24 to 48 hours if a client is about to undergo any procedure that involves dye. And common GI side effects can be diarrhea and nausea. And know that when used alone and it's not used with insulin or other hypoglycemics, this usually does not lead to hypoglycemia. And include in the patient education lifestyle modifications that such as proper diet and regular exercise. We also have your sulfonylureas. The example to this are your glipizide, glyburide, glimepiride. So how does this drug work? Okay, it is not an insulin, rather it stimulates pancreatic beta cells to release insulin. And thereby this is also indicated for type 2 clients. And we give these drugs if these clients cannot control their diabetes with their lifestyle. So this drug is given oral, typically once daily with breakfast. So some nursing considerations. So monitor for hypoglycemia, especially for elderly and those with renal impairment. Avoid the use of alcohol because it can lead to disulfiram-like reaction, or those who are trying to stop their alcohol intake, they will have the same effect if the person will try to use alcohol. Teach patient to eat regular meals to prevent hypoglycemia, because remember this increases release of insulin. And use in caution on patients with sulfa allergy, because this is sulfa in origin. Monitor weight gain as it is the common side effect. And finally, we'll talk about drugs for endocrine disorders. We're only focusing here on thyroid hormonal disorders. So the first one is the thyroid hormone replacement, and a common example is your levothyroxine. Now, generally speaking, this is a hormone replacement for thyroid, thereby its function is similar to the thyroid hormone, which is to increase metabolism. So this medication, uh, a synthetic T4 is converted to active T3. And with that active T3, it will now increase metabolic rate, increases oxygen use, causing growth and development. So we give these medications to those people whose thyroid glands are hypofunctioning, and thereby they're experiencing myxedema, This is given orally, daily taken on empty stomach in the morning. And it is given IV for those who are on myxedema, due to a low thyroid hormone. Now, since we're giving a thyroid hormone, we monitor our thyroid hormones as well, our thyroid stimulating hormone and our T4s. We teach our clients to take this medication consistently, lifelong, because it so happened this client has a hypofunctioning thyroid or poor functioning thyroid. Now, avoid concurrent antacids, iron, calcium within 4 hours of drug administration, as this antacid, iron, and calcium can interfere with the absorption of the thyroid hormone. Now, monitor for signs of hyperthyroidism. So we're looking at excessive use, which can lead to tachycardia, weight loss from too much activity, or metabolism, and tremors. and caution on patients with cardiac diseases such as angina and myocardial infarction, as this can aggravate them. And as a reverse, we have the anti-thyroid drugs, which are your propylthiouracil and methimazole. So as you can see here, it works the opposite. It actually inhibits T3 and T4, or it stops or lessens production of the thyroid hormone. So we give this to people suffering with hyperthyroidism, or effects of it, which is the Graves' disease, or those who are undergoing thyroid storm or excessively toxic level of thyroid. So this PTU is given orally in divided doses with meals. And one of five of the things we need to remember, this can cause changes in our blood. So one can be having a granulocytosis characterized by fever and sore throat. We can, it can lead to hepatotoxicity, especially this PTU or propylthiouracil. So we have to monitor our liver. We need to report signs of infection promptly. And this can be of long-term therapy, and effect, which is to lessen the thyroid hormone, may take weeks before it is noted. And avoid high iodine food because this is high in thyroxine hormones. Then we have the corticosteroids or glucocorticoids. An example to these are your prednisones, hydrocortisones, and dexamethasone. So what's the big thing with corticosteroids? They are anti-inflammatory. So they suppress inflammatory cytokines, thereby inhibiting cell activation, thereby decreasing protein synthesis. So this is given in adrenal insufficiency, in inflammation, autoimmune disorders, allergic reactions, because the goal is to stop the inflammatory reaction. These are steroids, and it can be given orally, IV, IM, topical, so it depends on the condition. If they can orally, take it with food, as it can cause GI upset. So being anti-inflammatory, immune system is suppressed, so monitor for signs of infection. Now, these steroids can increase gluconeogenesis, thereby we monitor blood glucose. And during, if the client does not need this anymore, we cannot just stop the intake. It has to be tapered down to avoid adrenal crisis. And signs of toxicity would be your Cushingoid symptoms, wherein person have moon face, buffalo hump, and we make sure that we educate our patient to increase calcium intake and do weight-bearing exercises, as this drug may lead to osteoporosis. And that's it. If you found this video helpful, don't forget to like, share, and subscribe. Thank you.